Don't tap the desk.
All right.
That's the only rule.
Yeah.
Other than that, you can say whatever you want. It's your job. Welcome into the Ben Burnett Show. My name is Ben Burnett. This is an...
What on earth would make you think I'm ready? Am I sitting down?
I was just gonna grip it and rip it. There you go. There's the outtake right there.
I can
It's
see-
him going, "What the hell are you
I
doing?"
can see who runs this show.
Welcome into the Ben Burnett Show. My name is Ben Burnett. My guest today is Jon-Paul Croom from Wellstar Health Systems. Jon-Paul, welcome in.
Thank you, Ben. It's great to be here.
It is an honor and a privilege to talk to you. I think hospital administration is fascinating. I think the Wellstar hospital system is one of the 2 or 3 major hospital systems in the metro Atlanta area. And so to get somebody with the experience that you have and your background in North Fulton, I think we're going to have an incredible conversation.
We'll look forward to it.
Thank you.
Yeah.
So let me start here. How does one tell everybody quickly what you do on a daily basis, and don't be shy. This is the commercial.
So I'm president of Wellstar North Fulton Hospital. We are one of 11 hospitals, which is part of Wellstar Health System. So on a daily basis, much of my time is spent, between the hospital or our corporate offices. I do everything from, overseeing operations at the hospital itself to being involved in physician recruitment and community activities and marketing the facility and looking for, to grow new services and trying to understand, what the community needs are and how we can help supply that need.
I first met Jon-Paul a couple of years ago at a Chamber of Commerce gala at the North Fulton Chamber, and you were speaking about some new. You have to forgive me because I, unlike you, am not incredibly well versed in medical equipment thingamabobbers.
Yeah, well, I just wing it most of the time too, but.
But you guys were announcing that you were talking through some new robotics platform that your North Fulton had. And my wife, so everybody knows, I talk about her all the time, is a Wellstar nurse. She works PRN for a Wellstar Urology over in Marietta, Kennesaw.
Okay.
And so she loves to work for you guys. In fact, I've only had to recuse myself over one item since I've been on the city council, and that was because she worked there, and I was like, hey, you guys don't need me to tell you your sign's okay. And so I kind of laugh about that. It's the only thing that I've ever had a conflict of interest over is my wife's PRN nursing job. So needless to say, we're big fans of Wellstar in general. So tell me real quick, when do you decide, what's the education path if you want to get into hospital administration? What is that like? And what drove you to it?
So usually the path to hospital administration, most hospital administrators have either gone and gotten an MBA or what's called a master's in healthcare administration. Some, like me, I went through a program at UAB where they did a dual degree, so I did both. But that's usually the education background. From a college standpoint, prior to being in graduate school, it's really all different types of people. People will come through with science degrees or liberal arts degrees or, political science degrees.
Which one were you?
I was a history major.
So you were well equipped as an undergrad to take on all the nuances of medicine in this country.
Oh, exactly right. Yeah. Yeah.
Well, and tell me real quick, what do you think? Tell me about North Fulton Hospital before you get there, and I'm going to ask you about the hospital that's getting built off of Old Milton Parkway, or the facility.
Right. So North Fulton was built in 1983, back when Roswell and Alpharetta looked much, much different than they do now. It was built on the site of an old barn. We have some great pictures in the hospital of that original barn where I think Milton High School and Roswell High School would paint the barn and depending on who was winning the football games. So that hospital was built. It went through several owners over the many years between then and now. And about 3 years ago, in April of 2016, Wellstar purchased that facility along with Atlanta Medical Center and a couple of other facilities in and below Atlanta. And so in the past 3 years, we've been part of this system. We are a community hospital. One of the unique things about our facility is that we are the only level 2 trauma center just north of Atlanta.
You beat me. I was going to go there.
Okay.
At some point, talk to me real quick about the level 1, level 2. Talk to me about what that means.
So in the state of Georgia, you have level 1 through level 4. If you are a trauma center or choose to be a trauma center, you get a designation, and all those designations are based on what types of services you can provide and what the frequency of those services are. So just speaking about level 1, when people think of level 1, they immediately think of Grady.
Absolutely.
So Grady downtown. Wellstar Atlanta Medical Center is also a level 1. So they're the other level 1 trauma center downtown. And
which Wellstar now is affiliated with.
Yes. So that's a Wellstar facility,
Property.
Right. And so what both of those facilities downtown do, they have 24/7 coverage of a whole list of different specialties, which include not only trauma surgeons, but everything from ENTs and plastics and it's just the whole gamut. All kinds. And all of these physicians have to be on call. They have to be able to respond to calls and be on site within a number of minutes, and to take care of all different types of trauma cases. The one big difference between a level 1 and what we are as a level 2 is at an Atlanta Medical Center and at a Grady, they have medical resident programs associated with their trauma service. So they do a lot of teaching. Whereas our hospital, we don't do that on a regular basis. Although we do see residents from time to time that'll come up from AMC to rotate through our hospital, but that's not, we're not an education facility for medical students. So that's where the big differentiation comes in. But from the services we offer, it's basically very close to being the same, which is why we see a huge number of trauma cases on this side of Atlanta coming to North Fulton.
Can you talk about real quickly what a research hospital is? Can you go into that just a little bit, because I think it's fascinating, and you hit on it that you guys are not necessarily a teaching hospital, and I know you'd referenced that you went to UAB, and that is, I spent a great deal of my life in Birmingham. And so it's a very fascinating thing that most people don't realize, that one of the best medical schools in the country is actually located smack dab in the middle of Alabama.
Birmingham, yeah.
And it's, I think that's one of the things that I know Augusta has, the Medical College of Georgia. And I just saw this week that Mercer has announced that they were going to go to Columbus. Do you think, outside of Emory, is there another facility in the metro Atlanta area that
provides that
teaching element?
Teaching element. Besides Atlanta Medical Center and Grady, which both have medical programs that rotate through there. There's Emory. I can't really think of anything else in this exact area.
It's really interesting. So talk to me real quick. I know that your hospital system, are you also going to oversee the old Milton facility? I know it's coming out of the ground. It should be online. You may know better than I would. At some point in the next year.
That's right. That's what the builders tell me too.
What's your affiliation with that going to be, and what kind of services are they going to provide?
So those services there, and the way that we're affiliated from a hospital standpoint is we have hospital presidents that run the hospitals, and then we have a whole clinic structure, which is called the Wellstar Medical Group, which is also a structure within Wellstar. We all work very closely together, although the clinics don't report in under the hospitals. But what we do have is a very close relationship with those physicians, and our goals are aligned on what we're trying to do, and the hospital and the physician group has to work very closely together. That particular facility will house several physician practices, which include family practice, internal medicine. We'll also have an urgent care at that location.
Did you hear that, Alpharetta? There's an urgent care going on Old Milton Parkway.
That's right.
What? Anything else?
Yes. So we will have specialists that will rotate through there, everything from OB to general surgery to ENT. And we'll also have a cardiology practice there full time, and we have cardiac diagnostics and a full radiology imaging center.
That's
We'll
amazing.
be there as well. Yeah.
And so the theory is that just continues to expand your footprint. How many people does Wellstar employ between North Fulton Hospital, and how many do you think will be there?
Oh, goodness. So our hospital, we employ 1,100 people.
Wow.
I think, yeah. So I think I don't know the exact number for that facility, but it's probably somewhere 50, 60 maybe, depending on part-time.
The time of day, sure,
Yeah.
and everything else. Well, I think it's fascinating to listen and really get to understand the ins and outs as you guys continue to grow your footprint. What are some of if you had to look, you have the great fortune being a president of one part of it. What are some of the challenges that you face, that you see on a daily basis with respect to employees, with respect to clients, anything like that? Are there trends that you guys see from an employment standpoint, from a patient standpoint, that you guys are actively working to address?
Sure. Yeah. We, the North Fulton area is unique. We're a growing area, certainly a well-to-do area, but we do have challenges, especially when it comes to staffing particular areas, and this is something that all hospitals struggle with. And I think you've probably heard of the nursing shortage, and we do see that. We see like the other Atlanta hospitals, just the ability to attract and keep and grow nurses, especially in areas such as critical care where there's additional training required, or trauma nurses. It's difficult. They're just, I think we all believe there could be much more opportunity to train nurses, and I would encourage anybody listening to this with any thought of going into nursing to take a serious look at it, because there is a lot of opportunity and will continue to be for a long time.
Is that the vast majority of what I would call your workforce, or nurses, med techs, or is it more office staff?
It's a mix. I would say nursing, so what we call nursing are traditional registered nurses,
BSN.
right? But we'll also sometimes we'll include techs in that number as well, which it makes up at least probably 50% of our workforce. Beyond nursing, you have all different types of what I call businesses within the hospital. You have people that go through that study imaging, like your X-ray techs and your CT techs. You have lab techs that work in the laboratory, and they have all different subdivisions of their jobs there. You have people that run biomedical engineering. You have people that run the facilities. So it's I always, when I talk about the hospital, I try to talk about it as it's a building that houses probably about 25 to 30 distinct businesses that all have to work together, and they're all come from different levels of training, and from time to time we struggle to recruit for those different areas.
What when you say that, do you have, when you were actively retaining, and let's take your average nurse that has been at Wellstar for 10 years. How do you guys address retaining those employees? Because once you're trained and you're a high functioning member of a team, you are very difficult to replace. Mm-hmm. But it's also really hard to train new people to come in, which I know is an active exercise.
Yes.
What do you guys do to ensure that your long tenured individual contributors to a unit are happy, satisfied? What's your secret sauce?
Yeah. So what would say is that, a area like Atlanta is a, urban area, and just like other urban areas, people have a lot of choice. I always say that, a nurse in the morning can decide to take a left or a right out of the driveway and can end up, at another hospital. There's a lot of competition between health systems for this limited talent. And when you have a nurse that's been working somewhere for 10 plus years, they're obviously have a lot of training, a lot of expertise, and they're very marketable.
They're invested.
Yes, yeah. We, what I have learned, not just at Wellstar, but throughout the years, I mean, it's not just money that moves an employee from one place to another. I think a lot of it has to do with the culture of the facility, with that person's team that they work with, that they feel supported by their manager, and all of these distinct units, they have to operate in such a way that it becomes a team and a family. That is one of the things I think, for the people that have been with Wellstar for a long time, they have a situation where they are, they feel part of this Wellstar family. One of the things we always say at Wellstar is we believe in life well lived, and it goes beyond just the workplace. We want to make sure that, we are providing, those types of opportunities for people to take time off and spend time with their families, because we understand it's not all just about work.
And you educate them through, I know you guys have a very serious effort for somebody who's spent a certain length of time there, you will continue to invest in their education as long as they're willing to continue to stay.
That's right.
And I think that is, I would like to say that that's probably a competitive edge, and that may just be where the marketplace is. You may have no choice.
Yeah. Right. Yeah. And I think, I think it's not just unique to our industry, but we just have to invest in our employees and continue to grow them. Technology is changing so fast. I think you mentioned earlier about the robotics program. We are doing a tremendous number of robotic surgeries at the hospital now, and that's not something that was being done prior to a couple of years ago, as far as the volume. And, we constantly have to train, new staff to learn new equipment, because those types of things change every 2 to 3 years.
What do you see? Let me ask you, I know 5 years in anything medical or technological is probably an eternity.
Yeah.
Do you see 5 years? Do you see the process for automating surgeries like that continuing to grow? Do you feel like it is close to a critical mass? And how do you balance that as you're recruiting young physicians out of medical school to do that? I would have to assume they're trained in a different way today than they were even 5 years ago.
Yes. Yeah. Training continues to change. When I first started seeing, robotic surgery, 15 plus years ago, a lot of physicians would go back and learn, robotic techniques and then come and do some robotic surgery at the hospital. But now what we are seeing, so many of these young surgeons coming out of fellowship have done robotic surgery in fellowship. They're learning on the new equipment, and when they are looking for a hospital, their expectation is they will be able to work on a robot.
It's amazing. I want to brag on you, and not you, your folks, for a minute, because you never realize what you have accessible to you in this community until it's forced on you and you need it. And my wife, who wouldn't mind me saying this because we've told everybody, about 2 weeks after she had our second child, couldn't feel one half of her face. And she's a nurse, and she was scared.
Yeah.
So when you're after childbirth, that's one of the times when a woman is at an elevated risk for stroke. And so to be able to go there, we could not have lived in a better location than to be off Mayfield Road, probably 2.5 miles in between the Alpharetta Department of Public Safety, who I'm sure you guys see multiple times a day, every day.
Sure.
And your neurological team. I mean, I sent her off in an ambulance with 2 little kids at home, and you want to talk about scariest day of your life? It's like, I don't fear death. I fear being a single dad. And to be able to go there and to have her continue to have those relationships with people in your staff and in the community. And even now she will literally remembers the firemen that came into our house that were a part of that whole thing as she went there. And it's really, we're blessed. And then to be able to turn around and have, you know, what you guys are about to do on Old Milton Parkway, just to supplement that hospital system, I think is truly, you take it for granted until you have no choice but to utilize it. You know what I mean? And so just the ability, and it didn't necessarily have to be stroke-like symptoms. It could have been anything. Mm-hmm. And you guys literally have the skill sets to do any of it.
Yeah.
And it's literally on Highway 9. You drive past it. Everybody that lives in North Fulton drives past it every other week and never gives it a second thought. That's a trauma to facility with more or less any kind of doctor that you would ever need in a pinch is literally on your doorstep. And on the same token, I want to ask you this, and you can field it any way you want to. Georgia is a large state. By any that's not really a political or philosophical opinion. If you drove from the northern part of the state to the southern part of the state, it takes hours and hours and hours, and it's very wide. And we are starting to hear a conversation about rural medicine. Uh-huh. And I know living in or having grown up in Mississippi, having lived in Macon, having lived in Birmingham, you have seen it through your different jobs and careers, access to physicians, access to health care. Where do you see that conversation going in the next couple of years? Because while Wellstar may not have a seat at the table because you don't want to be in Thomasville or you don't want to do something like that, I won't speak. I have no idea. Maybe that's the next place. Mm-hmm. Something in some capacity is going to get done. Who do you think the key stakeholders are to figuring that out? Because while Atlanta absolutely has over 60% of the state's population, that means 40% live everywhere else.
That's right.
And that's a big, this 40% of the people probably live in 85% of the state. And so I know that there is a Trauma One facility in Chattanooga. You guys have one. There's one in Grady. I'm not sure, but I would assume there's one somewhere in middle or South Georgia. Yes or no? You would know that better than I would.
Yeah, I probably should know that. I think that Savannah has one, and possibly Augusta, but I don't remember if they're level 1, level 2. Yeah.
How do you see that changing? Where do you think the state will choose to invest resources? How do we encourage doctors that are coming out of medical school to want to take that cause?
Yeah,
because you will have a seat at that table in some way, shape, or form.
Yeah, and I have, through my career, I've worked in rural places, and there are different challenges there for sure. In urban areas, it's much easier to recruit physicians. Obviously, physicians are just like everybody else. They want to go to places where they can have great school systems. They want to, their kids to have, activities. They want to be able to have a place to go and shop and go to, go to events. So a lot of times when I was in more rural areas, our challenges were always to find physicians who either grew up in a rural area or possibly grew up near that area, had some family tie. And it is difficult. It gets particularly difficult when you're trying to recruit specialists. So specialists, being your surgeons or pulmonologists or people that have gone on for another fellowship, and that is where we see a lot lacking in rural areas, just because the specialists, they just aren't enough, and rural areas do tend to pay more for those types of service. Oh yeah, when we would recruit, if it's not a place that people want to move, there's only one factor usually that changes somebody's mind, and And a lot of times, those areas are paying more. Either they're, employing or doing some other type of agreement to bring those types of physicians in. But what we are seeing quite a bit of is we were talking about technology earlier, and from a technology standpoint, we are seeing a lot of systems where there's telemedicine. I think neurology is one of those areas that took off the fastest. Many hospitals, especially in rural areas now, they have
VPN in, and
that's right. It's sort of like doing FaceTime with a neurologist. So somebody that comes into an ER in South Georgia would have an opportunity to basically pull what looks like an iPad up. A nurse is trained to run vitals and that sort of thing. A neurologist is sitting there looking at the patient, having that discussion, making a decision, whether to administer TPN or put the patient on a flight to a stroke center.
Wow.
So we are seeing more and more of that. In fact, teleneurology is one of the things we use at North Fulton. Even though we have many neurologists, we can get a neurologist taking a look at a patient immediately
in a more cost-effective way if they're
Right.
somewhere else.
Right.
You can see your doctor.
You can see them immediately, and it's been great for even us, even though we're not a rural location, to be able to have that access. I think we will begin to see more and more of that with other specialties as well in rural areas. Some of the things that are happening right now with robotics, I mentioned the surgery robot, but we also have one of the only cath lab robots in the state, which can be run in the room, but technically at some point, once we figure out how to increase internet speeds, I think with this 5G ultra low latency that AT&T and Verizon and all these other companies are rolling out, I would suspect in the next few years that we will start to see an opportunity in rural areas to have machines in place and technicians that are trained to attach these things to patients with specialists sitting in urban areas running these machines. So
It's fascinating.
Mm-hmm.
Well, what would you tell us? We'll finish here because you're an important executive. We got to get you back there and make sure you're in time for the liver transplant.
That's right.
What would you want to leave us with about why did you choose Wellstar? Why did you choose North Fulton? What made you relocate your family here?
A lot of different reasons. We had lived here in the past. My wife is from Atlanta, so that's probably the most important reason. Her family is here.
She's a Burnett.
She is a Burnett. So yeah. So we probably should have qualified that at the beginning.
We should.
So, yeah. She's from the area. Her family lives here. I have family here as well, and that was part of it. The other piece to it is, healthcare is a small world when you're in healthcare administration, and other systems, and which systems have great cultures. And I have wanted for a long time to work for Wellstar. In my position, you just kind of have to wait until the right opportunity arises. And when they reached out to recruit me a few years ago, this was the right thing to do. Our other attachment to this area, my wife and I were married 17 years ago this summer at Roswell Presbyterian. So we have a lot of long-term attachments to this area. So for us, it was coming home, and it's important to me, and always has been important with my hospitals to be a part of the community, because our community is our family. We see people that we know every single day come in the hospital, either scheduled or coming in with something they had not planned to visit us that day. And it's important for us to make sure that all of our patients receive a great experience. Most patients are, that go to hospitals in this area, they're already going to receive great care because we have a lot of great facilities in Atlanta. But it's important for us to try to differentiate ourselves with a great culture and with a great experience for that patient and that patient's family.
Well, you cannot convince my wife. When we had our first child and she went back to being PRN and working a couple times a month,
Yeah.
and they went so far out of their way to cater to her, to keep her. because she will work. You know, if we're around the week of Christmas, like she'll pick up a shift. She just loves, and you can't convince her to go anywhere else.
Yeah.
And so it's, when you speak of that culture, it's a real thing. And so she loves it. I wouldn't be shocked if she chose to, wheel her out of there someday when she's 80 and I'll be long gone. But Jon-Paul, I appreciate you coming in today. I appreciate your willingness to have a conversation about rural medicine and talk about things outside the Wellstar system and challenges that you face. And I appreciate you coming in and sharing with us. As things emerge and come, show up, I hope you choose to come back.
I would love to, and thank you for this opportunity. I've enjoyed my afternoon with you.
Thanks, everybody. This has been another installment of the Ben Burnett Show on the Appen Podcast Network. Have a good day, everybody. Boom.